So thank you everyone for the opportunity. So today I'm going to present the one-year outcome data of umbilical cord allograft in preventing the hypertensive phase in Ahmed glaucoma valve implantation. So when the trap fails, we all think about whether to restart the medications once again, or to plan for repeat trap with MMC at a different quadrant, or to plan AGB, and sometimes if it fails, can I go for a TSCBC? So we all know the indications for the implant surgeries. All the difficult glaucomas, the failed traps, the neovascular glaucomas are the indications where you do the GDDs. It has evolved from 1906 on the older implants to the recent advancement in the techniques like the Ahmed clear path or the Paul implants. So hypotony post-implant surgery is very critical, and it also progresses to different stages in the different implants like the valve and non-valve implants. So challenges in the valve implant is that after the initial transient hypotensive phase, we get to see a hypertensive phase which is defined by IOP of more than 21 in the first 3 months after the surgery, with a 10 cystic bleb and a raised IOP. It is sometimes analogous to the tenon cyst of trabeculectomy, when you get to see a 10 cystic bleb, and the incidence is quite high as 60 to 80% in the literature. So different risk factors are postulated, but the problem is that we are again back to square one, meaning that we again need to restart medications, and a significant amount of these particular patients also will migrate to failure. So just to present one short case, a 10-year-old girl with right eye Sturge-Weber syndromes presented with severe glaucoma, and after the first AGB, she had a refractory hypertensive phase, putting us to go for a second AGB. Then also we face the same problem, the hypertensive phase happened. And both implants are in place, but the IOP was not coming under control, so ultimately going for a TSCBC. So the management of hypertensive phase, we have extensive evidence in the literature of numerous techniques, but none is as of like with a long-term efficacy except the postoperative prophylactic medications and bleb excision. So the prophylactic medications, the aqueous suppressants, act as a medical ligature. So if the IOP is just crossing the early teens, you can start the medications, and it is proven to be effective in reducing the incidence of hypertensive phase and also reducing the height of the hypertensive phase. The AGV slicing is also described by Dr. Sirisha from Hyderabad, and it is in vitro studies being published, but in vivo studies are underway. So coming to today's discussion, so the novel umbilical cord allograft was proposed by Dr. Aparna Rao, and she has already published the data of the 6 months follow-up, and this is a technique, not a very difficult technique. After completion of the AGB implant surgery, the specific size of the pre-cut umbilical cord allograft is to be slided over the plate area, over the valve area, beyond the patch graft, and you need to simply close the conjunctiva overlying it. So very simple technique of the implantation of the umbilical cord allograft. And if you see the postoperatively the bleb height reduces, and we expect to have a low incidence of hypertensive phase. So this is the study, the 1-year outcome data of 44 cases versus 38 controls where we did not use this umbilical cord allograft, and the last visit IOP and the last number of medications in the last visit is less in the case group, though it is not statistically significant. But the number of eyes who need repeat glaucoma surgeries and number of eyes with high hypertensive phase is not different, even it is higher in the cases. So the Kaplan-Meier survival curve also shows that the eyes with the particular allograft didn't score over the eyes without the allograft. So we can say that this particular intervention in the long run does not hope to be that much effective. But since this is the only addition that can be effective after the anti-glaucoma medications use, so I think we can still have time to go. So to conclude, the road after the implant surgery is not always smooth. There will be ups and downs, so you need to keep driving.
Thank you, Dr. Roy, for that interesting study. The question is, how did you decide whom to put the allograft and whom not to?
So that study that we have I described, so in the first till middle of 2021, So didn't have the allograft. So all those eyes, the 38 eyes I have taken. So that was without the allograft. And after the allograft came into market, it is commercially available. So the rest of the patients we have been using.
And how do you propose it would have worked? It didn't work, but how did you think it would have worked? The fact that you put it on the plate, I
Yeah.
would think it would induce a little more fibrosis because it's not.
So it is like
you know-
anti-angiogenic and anti-fibrotic properties of the umbilical cord.
All right.
So it is
that's
being
okay.
extensively used in the ocular, the skin burns.
Yes. Okay.
So we hope that it might help.
Okay. Great. Thanks.